Analysis and evaluation. So most of us would be very familiar with this. Why is this important? Like, we're coming to repertory now. Why is this important? Or what is analysis and evaluation according to you?
It makes it easy to select a particular medicine, similar medicine.
Okay, similar medicine. Like, what do you do in analysis and evaluation? Simillimum, of course, we have to come to the simillimum. But why is this? Yeah, what you do in analysis and evaluation according to yourself, what you do in this? What actually happens?
In analysis, we bifurcate the symptom as per the location,
Yeah.
sensation, the modality, and the concomitant.
Very good.
So that the symptom we can come to whether it is a characteristic symptom
Okay.
or whether it is a common symptom. It's just a main bifurcation of symptoms
Yeah.
in analysis.
And evaluation?
Evaluation is grading the symptoms according to
Yeah.
their importance.
Very good. She is right. Why is it important, or what we are going to do? Why we have to do?
Evaluation gives us the grading of.
Yeah, I understand. What you told is,
Hold on to the remedy. Systematically hold on to the remedy.
yeah, all of you are correct. All of you are correct. But the main thing I would like to say is, we always get to hear, especially when repertorians, we get a criticism to be heard that you use any repertory, only polycrusts come up. Sulfur, Lyco, and few drugs only come up. That is because this step is not taken care of. We do repertorization with our own concept. Just like Dr. Jyoti came, we told in the morning, we could become casual prescribers. The same way, we become casual repertorians also. Means we don't analyze or evaluate. We just take the symptom, put it into the repertory, get a repertorization chart for making ourselves happy. We have repertorized. So this, especially this topic, is very important. Just to avoid such criticism or to go to the simillimum, it is very helpful, as you told. That's the reason I told everybody is correct from their own aspect. So we will see the introduction, the need for the study, what is analysis and evaluation, and come to a conclusion also. A homeopath, after collecting the data from the patient and logically arranging the symptom, forms a picture or portrait of the disease. We all are familiar with these words, picture, portrait. The conceptual image is formed, which gives the totality of the case. These slides all were prepared with the concept for PG, not PG home, MD in our CCH curriculum. So some highlighted, especially bold things, will be usually as a short note or essay. That's what is highlighted. I won't tell, so I just wanted to tell in between what it means. Totality depends on what kind of case you get. You will get acute as well as chronic. So what you will do in acute cases and what you will do in chronic. This is where we have to first put our mind into. If the totality of all the symptoms of the case which we get were covered by a single remedy, we get a case, and if a single remedy covers all this, then there would be no practical difficulty at arriving at the simillimum. Everybody will prescribe the same drug. But quite often such is not the case. Few symptoms may be covered by a particular remedy and few symptoms by another. We agree to that?
Yes.
So the physician has to evaluate the symptoms and select the important ones on which the prescription can be made. It is important that these points should be understood, because otherwise there is a liability to err in several directions. So these are the two important points before going to any repertory proper, selecting or analyzing or evaluating. You have to keep this in mind. Error may arise in placing too much emphasis upon a single symptom, or perhaps actually prescribing on a single symptom, as many of us do. One symptom, strong, we prescribe, and it may not be the perfect symptom. What error may arise in attempting to fit a remedy to a mass of indefinite symptoms. There are many symptoms and you are trying to put all of them together. So error may arise in attempting to fit a remedy to a mass of indefinite, unrelated or fragmentary symptoms by a mechanical comparison. It becomes a manual, just a mechanical thing of symptoms with symptom, by which the prescriber becomes a mere superficial symptom coverer. So what is a symptom coverer is this. That again used to be a short note. Failing in both these ways, the prescriber may fall to the level of so-called pathological prescribers who empirically base their treatment upon a theoretical pathological diagnosis, because pathological diagnoses are terms which are termed by us, so it is put as theoretical pathological diagnosis, and end in prescribing unnecessary and injurious sedatives, stimulants, combination tablets and other crude mixtures of common practice. Stuart Claus, Genius of Remedy, is the essential principle of remedy which gives it its individuality. Then lecture and essays from Stuart Claus, this is taken from this chapter, that he says what is the genius or the essential thing in the remedy which we have to prescribe upon. Let's just to quote. Okay, this again comes. How this analysis and evaluation came into homeopathy and why. During those eras, there was not a single concept like what doctor had told to analyze as per location, sensation, modality, concomitant. That is according to whom? You are analyzing as per location, sensation, modality, concomitant. Yeah, somebody has told that. Yeah, we'll come to the point. What has actually happened was, during that era there was nothing like that. Nobody had told. That time Borningason had proposed in an international conference, like, you can bring up ideas. He gave a couple of years and told, you bring up ideas for this particular process, how to analyze and evaluate and prescribe. He has put in a price question and waited for a couple of years. Not a single entry was received. Then he came up with the principle. Borningason had proposed a prize question to answer, which a period of 2 years were granted. This prize essay, as the homeopathic journals have also made known, was intended to call out a treatise concerning the greater or lesser, that is characteristic value of the symptom occurring in a disease, to aid as a norm or a basis in the therapeutical selection of the remedy. So he wanted to evaluate them. The competition was for the whole medical world, but it remained unsolved. Then he came up with what happened was Quis, Quid, Ubi, Cubis Oxalis. Yeah. That happened after he waited for 2 to 3 years. Then he had to build his own concept and put it to the world. That is the first time someone is putting the symptoms in an analytical or classified form. Analysis as per dictionary means analysis is the resolution by application of logic. There is some logic of complex structures or facts or propositions and concept into their individual elements. We divide it into the individual elements. Again, separating or breaking up of any whole into its part, especially with the examination of these parts to find out their nature, proposition, function, interrelationship, etc. That is the dictionary meaning, and we are also doing the same with some logic. Let it be location, let it be sensation, let it be modality. There is some logic behind. We are classifying it according to that particular logic. Evaluation of symptoms.